Welcome to It's Your Health, or I should say, welcome back to It's Your Health. We've missed you, and we're glad to be back on schedule again.
We'll tell you all about it after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back to the first segment of It's Your Health. Philip Benyo with my bride. And inquiring minds want to know, where have you been?
I'd like to say I've been to the Bahamas and to Hawaii, but no, I've been recuperating from some surgery.
That's right. We found an enlarged thyroid gland and
a big thing growing in it.
It was pressing on her trachea, and she was...
He was afraid I wouldn't be able to talk anymore.
She was getting short of breath for the wrong reasons. And so anyway, we decided, when in doubt, take it out. And so...
Well, I have to admit something to you. You know, I'm madly in love with you.
Right.
But I can love somebody in a different way, right?
I suppose.
I love Dr. Hahn.
Dr. Hahn and Dr. Pollack, his partner, here at the Greater Hazelton Health Alliance and Hazelton General, took out her entire thyroid. And to be honest with you, as you know, I could have gone anywhere up and down the East Coast to have this done, but I elected to have it done here because we have really tremendous physicians. She did a terrific job recuperating, no hassles, and it kind of irks me and is an illustration of we have the best here, and to go out of town for some things is truly a little crazy. Certainly your choice. And everybody has their horror stories about every place, and every place has them, by the way. But to be honest with you, it was great care, a great result. And
I must add something. I started off in the short procedure unit, went to the operating room, the recovery room, ICU, and the third floor. So I did a tour of the hospital. And if you think everybody was so nice to me because of my name, my insurance is under a different name. So no one called me Benyo at all. What do you know? And I was treated with the utmost respect and courtesy. No waiting, just couldn't have been any better than it was. And the doctor and my anesthesiologist and all the nurses, I thank you for taking such good care of me.
I thought you were going to say that to me.
Well, I do want to say something about him. This all started because I had to go for my mammogram. And he said, well, as long as you're going for your mammogram, go for a chest x-ray. And I said, I don't need a chest x-ray. And he said, if you go for a mammogram, you get a chest x-ray. So after we were done fighting about that, I had a chest x-ray. And that's where they discovered the whole problem, or it might not have been discovered for a while.
And you might have been short of breath for other reasons, huh?
You tried that line once.
Oh, okay.
It didn't work then, it's not working now.
Maybe we should,
thank you.
Maybe we should go to our headlines.
I think that is so smart that when somebody goes for a mammogram, they get a chest x-ray.
It's old school, but that's the way I am.
I'll say. Okay, we've got some headlines here. Our first headline is called Bedhead. Getting enough sleep can mean fewer senior moments. Women who slept more or less than the recommended 7 hours had memories of women 2 years older.
Well, it is interesting. We spend a third of our day sleeping, and it has to be restorative and restful sleep. And when that doesn't happen, bad things can intervene, particularly with memory and other issues. So,
speaking of which, when Charlie, our golden retriever, decides every night at 2 in the morning that he has to go outside, he doesn't wake up. He doesn't hear him. He doesn't notice a sound that is made.
Really? Jeez.
Yeah, really. Next headline. High fructose corn syrup linked to diabetes. Countries that mix high fructose corn syrup into processed foods and soft drinks have higher rates of diabetes than countries that don't use the sweetener, according to a new study.
Well, it's an epidemic, obesity, diabetes, and the like, and to some degree it has to do with us taking in too much sugar. And fructose is a concentrated sugar. We sometimes have difficulty handling that particular problem. And if you are a label reader, if you see high fructose corn syrup, put it back on the shelf. Do not take it home.
Not everyone is convinced, but we'll let it there.
As a Coke drinker, I guess you wouldn't be.
No, I would not be convinced. Oh, Brooke Burke-Charvet just followed my lead, but she had thyroid cancer. She's the beautiful announcer on Dancing with the Stars, and she faced surgery, had her thyroid removed, and is doing very well, even though she probably went to one of those posh, places that we didn't go to, but I did just as well.
You did just as well. And of course, thyroid disease in women, sometimes more common than you think. The thyroid sits right here, generally can be felt rather well. These things run in families, by the way. And generally, in addition to an exam, you might get an ultrasound of your thyroid, which may disclose a cyst or a growth, along with blood testing for your thyroid, and go from there.
It looks like a butterfly right here. And what kind of symptoms could a person have that would help them to know that maybe something's not right with their thyroid?
Boy, the list is a mile long, and it can lead from tired, weakness, fatigue, constipation, depression, feeling cold all the time, weight gain. Weight gain.
I kept gaining weight and I couldn't understand it. All I was doing was eating ice cream, and I just kept gaining weight, from the, I've lost 5 pounds.
I thought it was my cooking.
Well, that too, but I'm still eating the ice cream. So weight gain, weight loss, lots of things contribute to it.
We would say when I test thyroid in women particularly, we could maybe get 1 out of 5 that are off and nobody knew about it.
Well, everybody knows about it now. You can be just like Kathleen Benyo or just like Brooke Burke-Charvet and have it, if you can tell the difference between the two of us. We're going to take a break now.
Okay, not a bad idea.
And we'll be back with some more headlines and other fascinating news.
The fastest 30 minutes in television. You're watching It's Your Health. We're your leader in healthcare information. Be right back. Welcome back to the second segment of It's Your... Am I sitting correctly now?
You look wonderful.
All right. That's a first. I want a copy of this tape, by the way. Go ahead.
We're going to start with headlines rather than complaints because we get enough of those at home. First headline, ultrasonic bed bug devices debunked. They're useless. Despite their claims, ultrasonic devices won't keep bed bugs away. They produce sound waves that do little to deter these creepy, crawly pests.
And it is an epidemic, right? Bed bugs. If
I
you're
guess
a traveler.
So. I check everywhere we stay.
And what do you look for?
I lift up the sheets, the mattress pad, everything to get to the mattress, and then I look along the seam of the mattress for any tiny, tiny dark color spots. And if I see them, we're out of there.
All right.
And you know what's interesting? These ultrasonic machines give off a little bit of heat, which the bed bugs like. Oh. So they often go into them to relax, have a sauna. All right, next one. Fruits and veggies tied to lower breast cancer. Women now have one more reason to eat fruits and veggies. A new study suggests that women with higher levels of carotenoids,
Yeah.
Is that how I pronounce it? Nutrients found in fruits and vegetables have a lower risk of breast cancer, especially cancers that are harder to treat and have a poorer diagnosis. They recommend vibrant orange, yellow, and red colors like carrots, sweet potatoes, red peppers, and winter squash.
Again, it's inflammation in our bodies. We have diets that are very pro-inflammatory and nothing to put the brakes on this inflammation. So whole wheat, grains, fruits and vegetables will all be anti-inflammatory for your diet.
Pro-inflammatory, that reminds me of the other definition of inflammatory. Starting a fight with somebody, you're being inflammatory.
Not moi.
Oh, okay, never mind. This one's an interesting one, especially since Dr. Oz talked about it.
Okay.
And everything he says is true. Green coffee beans may aid weight loss. Ground green coffee beans taken daily seem to spur steady weight loss, according to new research.
I'm not sure the mechanism of that, and they have found that once you roast the beans and you degreen them, if you will, they're not as effective.
That's right.
So can I just go to wherever I go and ask for green coffee? How do I get these things?
You get them in a supplement.
Oh, you do? Okay, I see.
And but this was a they're acting like this is the discovery of the century. But this was a very small study that was done, and so they have a long way to go to prove it.
I see. Okay.
Most people lost 10% of their body weight.
Maybe it's a placebo.
Maybe.
Aren't you
I'm
warm?
not doing this one.
Listen, it's a New Year's resolution for us. So. But I think there's some good information that can be gleaned from this article, and we have a waiting public for you there, sweetheart. So,
Menopause and sweating.
okay, just
Hot flashes when you have menopause.
are you through that yet?
What causes hot flashes? I just had a hot flash last night. I was so warm. So super sensitivity of the skin, you could have a brain chemical imbalance, and there are things you can do to reduce your chances of it. The first one is my favorite, work on your weight. Go ahead, the next one.
Get a load of this list that you'll see up there. Working on your weight, of course, exercise will help any illness. Stop smoking. Several studies have linked smoking to the flashes. Throw some soy in your diet, believe it or not. Not that I cook with that. Maybe I should start. Stock up on tanks and cardigans.
Cardigans. Do you know what a tank and a cardigan is?
I think you'll show me.
Oh, I don't. Well, I don't hardly ever wear them. They're for people who have hot flashes. See, it's a sweater, and then underneath the sweater is a sleeveless top.
I see.
So that when you have a flash, you can take the sweater off, but I don't need to do that.
Let's go back on that list. We are controlling the air temperature, lower the heat, even run the air conditioning, keep up a window open, and pay to potential triggers such as alcohol, caffeine, spicy foods, and relax.
Yes, especially when you're with your spouse, it's always very relaxing.
There you go. Anything else?
I hope not. We're finished?
Yes.
You would let me turn on the air conditioning.
Do we have air conditioning?
You would let me turn on the air conditioning.
I'll let you open up the window.
I knew it. Okay, let's see what else is going on here. Ways to play it safe during pregnancy. Oh.
Right, when you're pregnant, of course, you're doing things around the house, and you don't want to expose yourself or your baby-to-be to noxious things like household chemicals.
Right.
You don't want to be using pesticides.
But I know when I'm cleaning and scrubbing, I'm often thinking, is this a safe product that I'm using here?
Do you know where our kitchen is? It's the first door when you come in the house.
I know, I pass through it every day.
I know, it's okay. So household products, you ought to stay away from some of those things. You'll see on the screen here what we've listed, believe it or not, kitty litter. can be not a good thing because that can harbor toxoplasmosis, which would be very bad if you got infected with that.
So give somebody else that crappy job.
Right. Dry cleaning types of things.
Hand wash instead. Don't use a dry cleaner.
Right. So there's a list of things that if you're pregnant, try to stay away from them because even though they're in your house, it doesn't mean they're necessarily entirely safe.
A lot of, well, not a lot, but some of the beautiful older pieces of pottery that we sell at our shop have lead in it. And you might buy them to use for display or to pot a plant in it. But if it's something with lead in it, you should not be eating out of it.
Good advice, sweetheart.
Thank you. And pesticides, you want to mention those?
Yeah, well, you shouldn't be spraying for bugs anyway if you're pregnant.
Food storage?
Well, some of the plastics they claim are not good for food storage. So
we got a bunch there that we have to be careful of, and people who want a nice, healthy baby need to look around at their environment is what they need to do. Because there's lots that, unfortunately, cannot go right.
Yeah, well, it's certainly dirtier out there than when we were growing up.
So do we have time to get to this next one? Would you like to do this one now, sweetheart?
Sure.
Okay. 4 signs of aging that may show higher heart risk. Receding hairline at the temples. Baldness at the head's crown.
Sorry.
Earlobe crease. And yellow fatty deposits around the eyelids.
Yeah, well, these are some things. In the olden days, when we saw someone with ear creases, we thought they had an increased risk of heart disease. Some do, some don't. It was an old-fashioned way of looking at patients. If they had earlobe creases, we'd say, oh boy, we're worried about that. The fatty deposits underneath the eyelids, that's actually cholesterol deposits, which can actually deposit in the iris. You could see what we call an arcus cinereus, which is a white ring. If you have those deposits, then chances are you have them elsewhere in your bloodstream. So they are sort of markers for heart disease.
That's the strongest of all of them. That's the strongest individual predictor is the yellow under the eye. Mm-hmm.
Right. So, that being said, I told you this is the fastest 30 minutes. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, It's Your Leader.
But I'm not finished.
In healthcare information. Sammy says you're finished.
Okay.
We'll be right back. Welcome back to the third segment of It's Your Health. I'm with my bride, the owner of Kathleen's Collectibles, purveyor of fine jewelry and antiques. I think I'm one of them, right?
Yes, but you're not for sale right now.
It's a rent option to buy, though.
True.
Okay.
Let's talk about the headlines.
Okay.
More deaths and illnesses linked to energy drinks. Boy, I have had a discussion with a young adult who's argued with me. He loves drinking these energy drinks, and I keep telling him it's not a good idea, and he keeps ignoring me. The FDA has posted adverse event reports for 2 more energy drinks. 40 illnesses and 5 deaths linked to Monster Energy, 13 illnesses and 2 disabilities linked to Rockstar Energy, and that is added to the 92 illnesses and 13 deaths to 5-hour energy shots.
Yeah, you really don't need these things. They can cause irregular heartbeats, spike in your blood pressure, miscarriages, psychotic spells, episodes. I think even suicide has been reported.
Convulsions.
Yeah, stay away from them.
Psychotic disorder. It's just amazing. You're getting all this stuff all at once into your system, and your system can't handle it. I keep telling him that. I'm going to have him watch the show.
Okay.
Drugs that interact with grapefruit on the rise. We've talked about drugs interacting with grapefruit, but it's turned into a major issue because some drugs, just 1 serving of grapefruit, can make it seem like a person is taking multiple doses of the medicine. And even if the grapefruit is eaten hours before you take the medicine, it still may have that effect.
Yeah, bottom line is if you're on medicines, you can't have grapefruit or grapefruit juice. That's just the way it is.
That's all you're going to say? I went through the whole thing and that's all your whole comment is?
You pull the load here, sweetheart.
Double check with your doctor before having grapefruit juice. How's that?
Why take the risk? If you're on a medicine, don't take grapefruit or grapefruit juice.
Oh, I'm not laughing at that.
Okay.
I'm laughing at this headline. The secret to a longer life, have children.
That seems to be a...
Many parents might good-naturedly scoff at the notion, but a new study shows that being a parent helps you to live longer. Fathers with a biological child were 2 times less likely to die an early death than childless men. People have kids, they live healthier.
So we're going to probably hit 100, huh?
And we're going to live forever at this point, I'll tell you.
Did people say why this is?
Because they're trying to set good examples for their children, so they tend to have healthier food in the house. They get the children involved in exercise, which gets them involved in, you know, group sports and activities.
So there you go.
And even school, to keep that brain fresh and busy when you help them with their algebra homework.
I hated that. I hated that.
I liked it. Okay, we have time to talk about sneaky, salty foods that you don't think are a problem, but they are.
Well, this hidden sodium, sodium of course leads to swelling, high blood pressure, weight gain, and there's 6 things here. Why don't you look at that list in which there are hidden salt. Keep in mind that we only need about less than 2 grams, 2,000 milligrams of salt.
How much is that? Is that a teaspoon?
It's 2,000 milligrams. That's how much it is.
Okay, I'm going to go measure milligrams when I get home.
Breads and rolls can have almost 15% of the daily recommended amount. Cold cuts and cured meats can give you a day's worth of sodium. Pizza, unfortunately, pizza, 2 pieces could have almost a day's worth of salt in it. Poultry, soups, particularly canned soups, you got to be careful. And sandwiches, you got breads with cured meats and seasoned meats, and big problems. If you knock down some of these things, you're going to knock down your sodium intake, which is going to help you live longer.
Packaged raw chicken contains added salt?
Yeah, as a kind of a preservative and sometimes a flavor thing, you'll see that it's injected.
Who would have thought? Makes them so plump. Okay, coming up, flu season. In fact, it's already almost here as we look at the flu map for the United States and for our area. But if you have a cold, are there ways you can make it worse?
Yes, you can make your cold worse. And again, look at this list. You're going to see, first of all, there's denial.
I'm not sick. I can go to work.
Right. Not sleeping enough. We talked a little bit about that earlier. Getting stressed. Drinking too little and drinking too much. Drinking too little, of course, you get dehydrated. Drinking too much, we're talking about alcohol. And do not use these nasal decongestants. They dry up the nose and cause more trouble. And of course, smoking. All these things together will make you and your cold worse and linger longer.
Mm-hmm. Linger longer. That's a good saying. What would you like to talk about now?
Well, why don't we talk about your trip to another country? You know, we went to Ireland to see the Fighting Irish start off
I took a trip to Ireland to see the Fighting Irish start off their season, and they won 50-10. And we went to Belfast and Dublin and Galway and the Aran Islands, and it was just magical. That is a beautiful country if you ever have the chance to go there.
And we tracked down some relatives on our Bristolin and O'Donnell side. There was actually a Bristolins meat market, so who'd have known? having come from Andy's meat market, that we were destined to be in the food business.
And not just the country that's beautiful, the people are beautiful. They're very friendly, very open, down-to-earth people, and there's lots of sheep, and they're so cute.
There's, I think, more sheep than people, though.
Yes, that's true.
There is more sheep than people. And it was a delightful time. It was even more delightful with my own.
Do we have any other trips planned?
I don't think so, sweetheart. I might go to McAdoo this weekend, so...
oh, I'm not going with you.
Maybe to Tresco, if I get my passport.
All right. Well, that sounds good. And maybe we'll get to talk another time about trips if we ever get to take one, or have an anniversary celebration in February, maybe?
Speaking of trips, you've had a lovely trip here at It's Your Health. Thank you for being with us, and thank you for allowing us to come into your home, inform you, and hopefully entertain you, right? Remember, you're watching It's Your Health. It's your leader in healthcare information. Thank you for joining us.
Bye.